It's often thought and said that men behave badly in relationship to their health. Actually, nothing could be further from the truth. Although men appear to be doing worse than women, in actual fact, men are very interested in their health. They just behave differently to women. Men behave like men, and the health system needs to respond to men accordingly. We're going to tell you about 4 common problems that affect men. If any of these affect you, then we want you to take this problem to your general practitioner. Are you getting up at night to pass urine? Once, maybe okay. 2 or more times? Not normal, definitely not due to aging, and unlikely to simply be due to your prostate. More likely, it's a beacon of a health problem somewhere else in your body. Things like being overweight or obese, or having high blood pressure, diabetes, or this condition obstructive sleep apnea. Closely linked to this problem of getting up at night is the problem of not quite having the power you used to. You know what I mean? The power down there? Erectile function. Not as strong or as long as it used to be. That's simply a problem of damage to your blood vessels most of the time, sometimes damage to the nerves, and they come from things like diabetes, obesity, obstructive sleep apnea. Hearing a common theme? Many of the similar problems that are related to getting up at night to pass urine, and the 2 of them often go together. Depression in men is just as common as it is in women, although it's not thought to be. Sure is. Men often somaticize their symptoms. In other words, they present more like bodily complaints than psychological complaints. That's often missed by your GP, so maybe you should just be a little bit more frank about how you're feeling. Have you noticed when you look in the mirror that your six-pack now looks a little bit more like a keg? Well, that might mean that your waist circumference has expanded enormously. Where is your waist? Not where your belly button is, because unfortunately that moves. Your waist is taken from the top of the rib, here, well that's the bottom of the rib really, to the top of the hip. Halfway is the narrowest point. You draw a tape measure around, read it from the side, and what should it be? Less than 95 centimeters. Any more than that, you're at risk. Over 100, you're at great risk. So the common thing is that men are accused of not talking. Well, as you know, if they want us to talk, they have to ask us questions. We're not like women. Women never stop. They continue to ask questions all the way out the door, and then they ring you up and still ask you some more after that. Men, you have to ask them. Unfortunately, your GP doesn't know that. So, managing your GP, make sure that they ask you the questions. Is there anything else you'd like to ask me, Doc? Well, if not, there are a few things I'd like to tell you. So what are some other bloke things about health? Well, when we want help, we want it now. When we make a decision to do something, we want to do it now. When we're worried about something, if we don't know what it is, we tend to self-monitor. So healthcare is all about access, it's all about education. You can Google it, but that doesn't replace my medical degree. Nevertheless, getting information is always helpful because it may serve as a prompt for how to guide you to seek action. Think of this video as that prompt.